Welcome to the fourth and last webinar of our inaugural World Psychiatric Association Evolutionary Psychiatry series. It's my great pleasure to introduce our speaker today, Professor Randolph Nesse. Professor Nesse is Emeritus Professor of Life Scientist at Arizona State University and Emeritus Professor of Psychology and Psychiatry at the University of Michigan. He's former founding director of the Center for Evolution and Medicine at the Arizona State University. Randy helped establish one of the world's first anxiety disorders clinic in Michigan and conducted research there on neuroendocrine responses to fear. He was the initial organizer and second president of the Human Behavior and Evolution Society, and subsequently became president of the International Society for Evolution Medicine and Public Health. He's a distinguished life fellow of the American Psychiatric Association, a fellow of the Association of Psychological Sciences, and an elected fellow of the American Association for the Advancement of Science. And importantly, from the point of view of today's event, Randy is recognized as the father of the field of evolutionary medicine. Randy co-authored a landmark book in 1994, together with George Williams, Why We Get Sick, The New Science of Darwinian Medicine, which inspired a whole field of evolutionary medicine worldwide. He has also written extensively about evolutionary origins of moral emotions, strategies for establishing evolutionary biology as a basic science of medicine, as well as on numerous other areas concerning the application of evolutionary science to medicine and psychiatry. In 2019, he published Good Reasons for Bad Feelings, Insights from the Frontier of Evolutionary Psychiatry, which in my view should be required reading for anyone interested in an evolutionary understanding of mental health and mental disorder. The title of his talk today is Why Relationships Exist, Evolutionary Foundations for Psychotherapy. Randy will be speaking for under an hour, and there should be plenty of time for Q&A and discussion afterwards. So over to you, Randy.
Thank you so much, Riyadh, and welcome everybody. It's good to see some old friends and some people I don't know but would like to get to know. And special thanks to Adam Hunt also for making all this possible, and to the World Psychiatric Association. For those of you who don't know, Riyadh and Martin Brunn and Dan Wilson have been instrumental in getting an evolutionary psychiatry section going for the World Psychiatry Association, as well as the Royal College of Psychiatry. And they are doing more than anyone else to build this field. So today is a special pleasure for me because I've had two threads in my career the whole time. I mean, well, actually three. One is, hey, doing the best I can for my patients, most of whom have anxiety and depression. That's always been primary. But the second thread has been trying to bring evolution to medicine in general with this preoccupation I've had, and now many people have, about why the heck didn't natural selection do a better job in shaping us so we're free of disease. But the other preoccupation I've had for almost my whole career is trying to explain how on earth we're capable of close, loving relationships and morality. And that turns out to give me a chance today to bring these two threads together and try to figure out if there's anything useful that can be done to make them useful for psychotherapy and psychiatry. And just, when you're doing psychotherapy, one of the first things you have to do is set realistic expectations. So I'm going to do that now for this and suggest that, I don't think there's any magic in applying evolutionary principles to psychotherapy. I think it's as useful for psychotherapy and psychiatry as genetics is for medicine, which is to say fundamental, foundational, essential, but not all that useful in the day-to-day practice. But we'll see what you think, and others may well apply these things in different ways. Let me share my screen and get going with some slides that I hope you'll enjoy. Those showing up fine?
Yes, great, thanks.
So really what I'm going to talk about today is the major advance that has occurred in the past 40 years and how we understand relationships and sociality. I think people don't really realize that we've had a huge sea change and huge advances in how we understand sociality and how natural selection shaped it. The opportunity we should talk about is how this can be used to advance our understanding of relationships and psychotherapy. So the core principle is extremely simple. It is that organisms are inevitably shaped to do whatever maximizes transmission of their genes. And the mystery with this is, why does anybody ever help another individual at a cost to themselves if in fact we expect that all organisms are doing just what's best for their own genes? Central to this is relationships. Relationships are at the center of psychotherapy. They cause mental problems cause relationship problems, and psychotherapy is crucial for helping people with mental problems, as I hope most of you are fully aware. But relationships are crucial here. But this is a missing question. Why do relationships exist at all? They don't for all primates. Orangutans mostly wander the jungle by themselves, only very occasionally. Chimpanzees form groups, bonobos form different kinds of groups. Natural selection shapes tendencies for different kinds of social behavior in different species. And for us, it shapes some quite extraordinary things. What kind of relationships are we talking about? Classic art offers an opportunity because this is what we really care about in life. We care about relationships. And Romeo and Juliet are the kind of the paragon of both romantic love and its troubles. We go on from there to what happens next. Sure enough, babies and relationships with babies and families. And those are special relationships. John Bowlby is really the founder of evolutionary psychiatry, and he pointed out about how attachment capacities evolve. And then marriage goes on. I don't know, this is not all marriages, but it's some. Did you know that the actors for these models for this painting were carefully selected and staged? This isn't just a random couple plucked out of the farmland. That guy's actually a banker, apparently. And then there's the richness of social life in general. I mean, everybody constantly in a constant melee of connections and disconnections and alliances and breaking and status. It's so wonderful, and it's also pretty hard. You get into middle school, and all of a sudden, all of these kinds of competitions start off, and it gets difficult as well as wonderful. But then we go to the workplace instead of the family, and all kinds of other things are involved. Julius Caesar, standing there on the right, thought that Brutus was his best buddy, and he was until he wasn't. The kinds of conflict that arise in the workplace and in politics are the stories of history. Here's a fellow you all know. Everybody talks about Oedipus wanting to have sex with his mother, wanting to kill his father. He didn't want to kill his father. He didn't want to have sex with his mother. This is Oedipus with young man syndrome. He meets this old guy at a crossroads, and he decides, I'm going first. And the old man says, I'm the king, I'm going first. So Oedipus says, okay, I'll kill you because I'm a young man and I have to do that kind of thing. This leads, of course, to tragedy. There he is with his mother. Yeah, unfortunate if you accidentally have sex with your mother, and look at everybody else. I mean, everybody shuns him as a result of this. Talk about the power of a group. And before you know it, he's gouged out his eyes and started wandering by himself. But there's someone who helps him. This is the most profound relationship of the whole Oedipus trilogy, I think. This is Antigone, his daughter, maybe even by his mother. She might share 75% of her genes with Oedipus, but she is there guiding him in his blindness. What an amazing relationship this is. And I see Antigone as a seminal figure in the history of relationships, because what she does next is with Polynices, her brother, and Oedipus doesn't want him to be buried. And the next king says, if you go anywhere near him or try to throw dirt on his body, you'll be thrown in prison or maybe killed. And she does it anyway. Why does she do that? And this is nothing about improving reproductive success, is it? I mean, this is someone, acting out of moral conviction against all self-interest. And these are the things we need to try to understand. So this is a mystery. If organisms tend to do whatever maximizes gene transmission, how the heck did selection shape our capacities for relationships, helping, commitment, love, and morality? So the old answer for decades in biology, uncritically accepted, is that capacities for costly helping are shaped by benefits to groups and species. It just seems so obvious that what is good is doing things that harm yourself and help your group or your species. It just seemed obvious. But there's a problem with this. If there's variation and individuals with greater tendencies to help the group have fewer offspring than others, then tendencies to help will be shaped out, selected out. So George Williams in 1966 wrote a book, Adaptation and Natural Selection, that changed the course of how biologists and eventually the rest of us understand commitment. In essence, he argued that group selection is not a viable explanation for costly traits. And more specifically, if there are heritable helping tendencies that decrease individual fitness, they'll be selected out even if they benefit the group. My favorite example is this picture of lemmings. You probably know the story about lemmings. It was the idea that Walt Disney fostered was that at the end of the winter, when food was scarce, some of them had to jump into the fjords so that there would be enough food so some of them could continue the species to another generation. It kind of made sense. And they even had pictures of lemmings jumping into the fjords, except those were actually staged pictures with guys with brooms sweeping them into the fjords, actually. The truth of it is that any genes for that trait, as you could tell from this fellow, would be eliminated. That's the guy who will pass on his genes. The rest will not pass on their genes. It's just not possible for a trait to be selected because it's good for the species. So I claim that this is a psychic trauma. People didn't really realize it until Richard Dawkins wrote The Selfish Gene, a spectacular metaphor, and even better meme. It spread very quickly, that made people think that they're all agents of selfish genes. And it made a lot of people think that, hey, selfishness must be natural. It's unavoidable. Even our altruistic acts must be selfish. And it made a lot of people think genuine altruism is impossible. So I personally found this to be a trauma as well. It just shook me to my core to realize that there was some scientific reason for thinking that my best attempts to be good were actually just more sly ways of advancing my genes' interests. This is truly a transformed worldview. That forest, it's wonderful, isn't it? Grand trees striving for light. But once you take an evolutionary view, you realize that it's all terribly wasteful. They could all grow 3 feet tall and capture just as much light. The only reason they grow so tall is because they're competing with each other, competing viciously for light, even though a lot of them are the same species. Selection acts mainly at the level of the gene. I think this insight is as threatening as the Copernican, Darwinian, and Freudian revolutions. So the ideas about group selection will all still continue and controversies keep cropping up. I'd like to just emphasize that selection by groups, by group influences, is very strong. That they shape motives that help and conform to motives to help and motives to conform to the group, and those increase in the individual's fitness. But selection for group benefits at a cost to the individual, it really can't happen. It can only shape traits with big benefits to groups and minimal costs to individuals who are usually related. West, Griffin, and Gardner, and West has done so much service trying to make all of this clear. They write in Journal of Evolutionary Biology in 2007, there is no theoretical or empirical example of group selection that cannot be explained with kin selection. In contrast, the group selection approach is not only less useful, but also appears to frequently have negative consequences by fostering confusion that leads to wasted effort. So I emphasize this because many of our colleagues in evolutionary psychiatry are very enamored of the idea of group selection. It's very clear that groups have a lot to do with our behavior. And besides, it's an appealing idea. It seems to be more moral somehow than selfish gene thinking. And I think we need to be realistic about this. So is this all over? Are these battles over? Sadly, no. The whole academic area of trying to understand cooperation is marked by vicious competition. This is a painting about Ivan the Terrible destroying Kazan in 1552. And the tragedy is continuing. This is a town about 500 miles west of Moscow. And the people in Moscow, the armies in Moscow and Russia decided they had to destroy it because it was trying to break away from Moscow. And of course, Kiev is also about 500 miles southwest of Moscow. These tragedies just continue for similar reasons. But these are the altruism wars. This is big battles continuing about how to understand the origins of our huge pro-social capacities. George Williams was right in the middle of this. In 1993, he published an article saying, "Mother Nature is a wicked witch." He says, "It's undoubtedly true that many of the ethical systems that are preached and sometimes practiced are thoroughly unselfish and genuinely altruistic. This means that the benign motivations that underlie them cannot have been directly favored by natural selection. They must have been produced indirectly by some sort of accident, the sort of thing that happens routinely by an evolution. On an evolutionary timescale, natural selection is immensely powerful, but it's also abysmally stupid. It's utterly indifferent." His deep thinking about the origins of sociality led George to a deeply, deeply cynical view. Contrasting, though, he was an extremely moral man. How do we manage that? So that was 1993. This was right in the middle of my work with him. We published this article in 1991 about the dawn of Darwinian medicine. In 1994, we published Why We Get Sick. So he and I had days-long discussions about all of this, and I tried to explain to him that my perspective as a psychiatrist just didn't fit with that at all. Neurotics outnumber sociopaths 10 to 1. And the belief that everyone is self-interested, which is what George was proposing, is basically self-fulfilling because you surround yourself with other people who are self-interested. Worse yet, the belief that love is an illusion, that's also self-fulfilling because nobody's going to love you if you say that love is just an illusion. And that these schemas, as a psychiatrist, they're very hard to change. People come into your clinic and they're untrusting and they've never experienced a good trusting relationship. It's not something you fix with a quick short-term therapy. And this made me worry also that selfish genes might be a toxic meme, that learning about this, at least in a simplistic way, might actually harm people's ability to have relationships. So I wrote a chapter, Why So Many People with Selfish Genes Are Generally Nice, Except for Their Hatred of the book, The Selfish Gene. And this little article, this chapter I wrote, really takes a psychodynamic look at how people respond to this trauma, some denying it, some embracing it, some arguing about it. It's fascinating how people try to cope with this insight. But grossly, I mean, the whole circumstance, I think, as it continues, is that we all are simplistic thinkers. One schema is that people are naturally good and helpful, and lest they're damaged or corrupted. And another is that people are naturally bad and selfish unless trained and constrained. You will recognize in these two schemas large-scale political groups that derive all kinds of public policies from these simplistic ideas about what human nature is like. In fact, I should stop here for a moment and share with you my secret personality question I use with patients I'm trying to understand. I often ask them, can you just tell me what you think about human nature? And what they reveal in whatever they say about their views of human nature turns out to be profoundly useful in figuring out what kind of treatment will work for them, what's needed, and the kinds of relationships they're likely to expect and to create with other people. So I've told you all about the conflicts, I told you about the complexity, and now I'm going to grossly simplify everything so that we can talk about these major advances. I'm going to simplify them into 4 evolutionary explanations for capacities for helping. The first is kin selection. John Maynard Smith, as you probably, I'll come back to that specifically in a moment. Kin selection, your kin have the same genes you do, so you can do things that help them and help your own genes, even if it's costly to you. Second is reciprocity. You can do things that help others if there's a likelihood of a payback from them later. Mutualism is when you're helping them and they're helping you, and actually both of you are constantly doing what's in your own best interests. And finally, there's enforcement. which I think is the growing recognition in the past 10 years, enforcement that maintains cooperation, often because there's no cost to the enforcement. So each of these gets only one slide. This is going to be quick, but I'll try to be fair to each of these. This is J.B.S. Haldane with the pipe on the bottom there, noting that his apocryphal statement in a pub in England was cited by everybody, and I'll cite it too. People asked him, would you sacrifice your life for your brother? And he says, no, not for my brother, but I would for 2 brothers or 8 cousins. And that, in a nutshell, summarizes Bill Hamilton's famous formula that you should help another whenever the cost to you is less than the benefit to the other times the percentage of genes in common. This completely revolutionized the study of sociality and animal behavior, and it has proved profoundly useful in understanding human behavior. People ask me, so what does evolution explain about human behavior? Is there anything? And I say, yeah, parents really love their kids, and they make huge sacrifices for them, just like most other animals do. The second gets us to relationships between non-relatives. They often cooperate in deep ways. How come? Bob Trivers first brought this to everybody's attention with his talk about reciprocal altruism, although it's not exactly altruism. And Bob Axelrod, my colleague at University of Michigan, led the charge with trying to understand, and work with Hamilton actually, about how trading favors as manifested in the models of the prisoner's dilemma could help us better understand how relationships work. Basically, you give somebody something and you expect and hope that they'll give it back to you later. It brings up the possibility of cheating, which makes it all rich and complicated. But these are transactional relationships. By that, I mean, there's no love and long-term kindness involved here. There's just expecting that there's going to be a payoff. But this has been so tractable from the point of view of research. There are articles on prisoner's dilemma. There are now 144,000 of them. Talk about a research endeavor that has really taken off. It's because it's simple, but it gives us an understanding of human relationships that I think is way, way too simple. There are a lot of mutualisms that look like altruism, and it turns out that lots and lots of cooperation is just individuals doing what's best for themselves. The oxpecker is pecking those ticks off of the ox benefits, the oxpecker benefits, it's cooperation, it's altruism, but nobody's sacrificing a thing. And then we get to things like the cleaner fish inside the mouth of a larger fish, and the baker. I mean, your relationship with your baker may be close. You might appreciate your baker, and the baker sometimes gives you a baker's dozen to encourage you to come to him and not some other baker. But basically, if he stops giving you bread or if you stop giving him money, it's all over. The last category is enforcement. And a lot of enforcement turns out to emerge from self-interested behavior. Bob Axelrod's original work focused on how could you explain the costs of enforcement. And newer work, especially that done by Foster's lab at Oxford about bacterial cooperation, points out that enforcement is often in the interests of the genes of the enforcer, even if it looks costly in the short run. And then there are contracts. And what's marriage but a contract, especially in the interest of the bride's parents? These are contracts to do certain things. Business contracts are made possible by writing things down. Society has emerged from capacities for enforcement that make longer-term relationships possible. So summing that up, it's a huge advance. I think all of us in social science should just be so appreciative that we now mostly understand social behavior, the benefits to kin, trading favors, mutual benefits, and enforcement. And I'd like to recommend a new book by Arvid Agren out of the Foster Lab in Oxford, A Gene's Eye View of Evolution, which gives a lovely overview, especially of new work about cooperation in bacteria. But this doesn't explain everything. And from my work as a psychiatrist, I'm sure yours, you see examples of things. In fact, we see all kinds of things that other people never have to confront at least as much as we do. In particular, I ran a group for cancer patients where they discussed what it was like psychologically to have cancer with their caregivers, doctors and nurses. People told me I shouldn't run that seminar because it was too intense. And I said, oh no, it'd be good for people to talk about it. gosh, after doing it for a year, it was just so intense and difficult for everyone. Sometimes we saw things that were absolutely we saw somebody who, had just moved to a different place, and they decided to get divorced, and she got breast cancer, and he decided to move in and take care of her. And he did for years until she finally died. And you see these incredible examples of commitment and devotion and love in psychiatry that are very hard to see or understand or believe sometimes. On the other hand, the other thing we saw that which was so heartrending is long-term, apparently good marriages of 20 years, and instead she announces she has cancer, and a week or so later he says, I've never really loved you, I'm leaving. I mean, how can that be possible? But it happens a lot. Another friend who worked in a ward for quadriplegics, and her job, the Lord help her, was to try to do marital therapy for couples where the man had just become quadriplegic. You can just imagine what that was like. The conflict between obligations and commitments and morality and self-interest were just wrecked everybody's lives. But this is the question: how does selection shape these capacities for love, morality, guilt, loyalty, and committed relationships? The four we've just talked about are insufficient. And there we go. So this is, again, this makes it seem as if group selection has to be the right explanation, or maybe cultural group selection. Don't think so. There's another explanation which has not been fully appreciated. And we start by recognizing that these human moral capacities are as extravagant and as expensive as a peacock's tail. Jeffrey Miller years ago suggested that perhaps it was sexual selection, that people chose mates who were moral. I don't know why people haven't paid more attention to that. It seems like a good idea to me, but that's just a subsection of a much broader, more potent idea, and that is social selection and partner choice. This can shape extreme post-sociality. I first came to it by reading Mary Jane West Eberhard's articles that she wrote in the 1970s at University of Michigan over and over again. And I finally grasped what she was getting at. Also, Peter Hammerstein and then Ronald Noe have talked about it from an economic standpoint about partner choice. Steve Frank is an evolutionary biologist who's done wonderful mathematical modeling and tried to make this clear to the rest of us. The idea, here are all the other people who've been writing about this, including three articles I've written at the bottom there, trying to point out how social selection can shape extreme altruistic tendencies. Here's how it works. Everybody's trying to choose the best possible partners, whether it's in marriage or business or going hunting or whatever you're doing. And if everybody chooses the best possible partners, that will affiliate those who have the most to offer and those who are the most cooperative and the most altruistic with others who have the same things to offer. This is kind of a nasty process, actually. It puts all the people who have the most, both in terms of altruistic tendencies and resources, together, and they get huge benefits. And sadly, and probably also very important for another talk about evolutionary psychiatry, are all those who don't have that much to offer and get left at the bottom of this hierarchy. But the bottom line for us today is that those who have the most to offer and are the most altruistic and are preferred as partners get associated with each other. They get big advantages, and this results in possibly runaway selection for displays of wealth, generosity, empathy, honesty, and loyalty, anything that makes you a desired partner. You see this all around you once you start grasping it. So why is it that flowers are so extremely dramatic? They're so costly. Why did they do that? And it's because they're competing. They're competing within the species to be chosen by pollinators. So this is all around us every single day. If you're choosing a job, you want an employer who's going to treat you well. And likewise, the employer is trying to choose an employee who will be loyal and hardworking and honest and all the rest. When we're choosing mates and choosing friends, we test people out, we go with them, we try them out, and we see if they will help us, if they're going to be loyal and honest, or if they'll betray us. And then there are clubs, sport groups, all kinds of human groups work on this principle of choice, affiliating those who have the most and share the most with others. The point here is that these are self-interested choices that shape extreme pro-social tendencies. I think this resolves the apparent paradox of selfish genes creating generous traits. Social selection shapes display that conspicuous consumption. These displays of wealth and power shaped by social selection, but also generosity to friends, not just to everybody. Empathy and theory of mind are very useful if others are wanting that to choose who they associate with. Social anxiety has been the center of my career. We'll talk about that in a minute. But we're also sensitive to what other people think of us. And we have moral passions, which aren't always that pleasant, guilt and shame. But at the bottom line, we are so concerned about what other people think about us. And I think the reason is it's been shaped by social selection and reputation management in general. Gene culture coevolution is also important. I'm not going to emphasize it here, but there's a whole field that studies how groups that have people with more cultural tendencies for cooperation do better than groups that don't have so many people who cooperate. And I think it has to get started with social selection and partner choice. But once that creates relationships that work, it creates pro-social traits that make culture possible. And culture creates new selection forces that create yet new social abilities, create groups that do better than others and groups that do worse than others, and creates more elaborate social traits in this marvelous positive feedback cycle that leads to the extravagances and wonders and terrors of human culture. Another angle on this is trying to understand things from the lens of commitment, which I thought was going to provide an answer back about 20 years ago. Commitment is when you promise to help someone even when there's no return to be expected. And they promise to help you when there's no guarantee of anything coming back. Cosmides and Tooby have nicely summarized this as the banker's paradox. Bankers are very glad to lend you money so long as you have collateral. But when you really, really need money, they won't touch you. Commitment, however, provides resources when you really, really need it, and therefore is extremely valuable if, in fact, you can trust the other person to make good on the commitment. And therein lies all kinds of wonderful paradoxes, deep emotions, and history and narratives. So summarizing the big advance just very simply, capacities for many kinds of relationships are shaped by many kinds of selection forces. The big four, reciprocity, kin selection, mutualisms, and enforcement, are all very important. And trying to emphasize one to the exclusion of the others is the tendency that leads to a lot of debates for no purpose. And I'd like to add to that social selection partner choice as a very essential fifth part. And again, they all act together. And I'm kind of doing what I'm criticizing others for doing, right? Everybody says, this is the big part of it. This is the center of it. I do think, however, that social selection is badly neglected and is terribly important. So how do we apply this to our work in psychiatrists and psychotherapists? This is just barely developing, and I think it's been impaired by confusion about evolution and cooperation. And maybe this attempt can help it develop further. 3 ways, I think: understanding disorders, understanding relationships, and how to manage therapeutic relationships. I spent much of my career treating people with social anxiety. Early on, I thought, oh, what's wrong with these people? They should just recognize that other people aren't that worried about them, and they shouldn't be so preoccupied with what other people think. But once I started recognizing the evolution of social capacities, and especially social selection, I recognized that preoccupation with what others think about us is absolutely central to our lives, and it's normal and useful. And I also, as you almost certainly have, met more and more people who weren't all that socially anxious, many of whom are really annoying to be around because they don't care too much about what other people think. Not good choices as partners. Neurosis, I think, makes more sense in this framework. It has benefits. It gets you preferred as a partner, first and foremost, and you have high empathy, and that gets you connected with other people who have high empathy. But it also comes with big costs, sensitivity to criticism, and also if you're trying to please partners, you're going to be attracting exploiters. And if you attract too many exploiters, that makes it likely that you'll become cynical. So it's a very fine line. If you just adopt a helping persona with everybody, you'll soon be disappointed and become cynical. Then, of course, there's the essence of neurosis, which is negative affect. And I think these are all useful affects to maintain your preference as a social partner. Sociopathy is in some ways the opposite of neurosis. And the question that some of us have discussed recently is it in fact pathology or strategy? Linda Mealy back decades ago argued that maybe it was a frequency dependent strategy that gave you benefits when there weren't too many other sociopaths around. The whole idea continues to be very interesting and controversial. I wonder, however, if it's not just that social environments always vary, and that the cognitive cooperative cultural niche is still very new for our species and is still evolving. So it's not surprising that there's wide variation. This is a diagram of a wonderful genetic analysis of mental disorders, and it comes to a profound conclusion that there are two main axes of disorders. Some of them over here on the bottom left, these are antisocial, drug abuse, and like conduct disorder. All of these are the ones I mostly treated in my anxiety clinic: major depression, agoraphobia, panic, and social anxiety. Why is it that the disorders divide so nicely genetically even into those that involve highly pro-social traits at a great cost of negative affect and more antisocial traits? I think this is central to our evolutionary approach to understanding relationships. There's much more to be done with this. Then we come to borderland personality. Again, there's so much to be said about that, and it's not one thing, but those of you who have treated such patients or tried to often find that they're desperate for deep relationships, even with you, and they flatter you dramatically in the first few sessions until you realize that 3 sessions later, they're going to be blaming you for everything that ever happened bad in their life. But they're also desperately fearful of being abandoned, so they seek reassurance constantly that you really, really, really care, and that you'll answer the phone at 11 p.m. at night when they're suicidal. And that kind of seeking of reassurance everywhere ends most relationships, including some therapeutic relationships, creating a very nasty positive feedback cycle where their expectation of being abandoned gets realized by their behavior. These are questions that we as therapists can ask about a relationship that a patient is having trouble with. Is it with kin or non-kin? Is it an exchange relationship or a communal relationship or something in between? Is it equal or hierarchical? What resources? What do partners offer to each other? What strategies of influence? What's the outlook? You really can get a lot further by asking these questions about a relationship. However, we also have these very powerful intuitions about relationships, and I think these categories are pretty feeble compared with the intuition of an empathic therapist. We can also ask how people influence each other in relationships. There's obviously bargaining and promises and threats. Then there's praising, helping, and caring, and threats, attacks, and revenge. And then there's shaming and guilt, and appealing to moral things and reputational things, eliciting pity, threatening to gossip or gossiping. And then there's threats to leave and actual leaving. This is what happens in relationships, not just with spouses, but with children and with others. But here again, I think our intuitions as clinicians, if they're functioning well, are generally superior to schemas based on evolutionary understanding of the resources being exchanged and the like. Nonetheless, we can create a very simple diagram of kin versus non-kin relationships and transactional versus committed relationships. And I want to emphasize this because it's so important to try to recognize the differences between committed and transactional relationships, and to avoid the very serious mistake of treating committed relationships as if they're just exchanges. In particular, there's marriage. Because marriage is at the intersection of all of these things. It's kind of kin, it's kind of non-kin, it's kind of transactional, it's kind of committed. This is why marital therapists need such extraordinary skill to try to do their work. I made before the point that transactional and communal relationships are so different. Communal relationships are sustained by subjectivity and emotions. And if you as a therapist start calling attention to the exchanges without being very cautious, you're liable to wreck things. I once was taught by someone how to do marital therapy by making lists of what each partner brought to the relationship and what deal they had cut with the other partner to give and get. And it was all true. It was very insightful, and it brought the couple together. And the way it brought the couple together is with their unanimity that these therapists knew nothing about marriage, and they really needed to find a new therapist. Yes, sometimes it is useful to call attention to what's being exchanged. There is exploitation that needs to be addressed, but acting as if we can understand all relationships in terms of exchanges in an objective way, I think is a gross mistake that can be fostered by a crude evolutionary approach. So 4 things finally that therapists must manage: patient's expectations, trust, distance, and the relationship itself. Again, we come back to where we started. Relationships are central to people's lives, to their emotions, their mental problems, and to psychotherapy. I think we now know a lot about why relationships exist. Can that help? One thing I found in looking up things for this lecture is that my original knowledge that relationships are the crucial aspect to most kinds of therapies, and that's why there are 200 different kinds of therapies, all of which can work. I found that there's lots of good research now. This is a meta-analysis by Laska of dozens, I think scores of studies. But the fascinating thing is that the factors that influence the quality of outcome are overwhelmingly aspects of the relationship. What kind of treatment, cognitive behavioral or insight-oriented and the like, accounts for less than 1% of the variation in outcome. Now, this can't be completely true. I certainly treated a lot of my patients with phobias with psychodynamic therapy, and it gave great insights that didn't work in changing people's phobias. Then I switched to doing cognitive behavioral therapy or mostly just plain old exposure therapy, and got people better in an hour or two. So it's not completely true, but it is true that the nature of the relationship in psychotherapy is profoundly important in getting people better. Then there are expectations, too high, too low, too uncertain. This is a very tricky business because hope is essential. But if you overshoot and give people too high expectations, they'll be disappointed and leave therapy appropriately disappointed. And then there's trust. Michael Balint and others have talked about basic trust as foundational for success in life and something that's easily lost depending on early relationships with parents. It's a common problem. People just don't trust other people in a very fundamental way. This can be helped in psychotherapy, but not in some 6-session wonder. I think this takes long-term commitment between a patient and a therapist. And even then it's very tricky because patients constantly are expecting you to be non-trusting, and they can see examples of it. Excessive trust is equally problematic, but not so common. People assume that others will be catering to their needs and trying to help them at all times, and they get sadly disappointed. What most of us do, and I think what we can teach our patients, is gradually to assess people and choose whether they're trustworthy based on experience with them and see. We do this often by sharing secrets with each other, but that doesn't work in psychotherapy. It's a one-way street. Our patients share secrets with us and expect us to maintain them. And we don't share secrets with them, except in very certain kinds of therapy. And that makes it a very awkward, unbalanced kind of relationship. And this is a constant thing to be managed in psychotherapy. That's related to distance. Some patients want to invite you to dinner at their house. Do you do that? Not really, unless you're, again, a certain kind of therapist. Other patients want to maintain an objective distance so that they say, just tell me what to do and I'll get better. It's a very delicate dance, and I think there's no substitute for dealing with distance using empathy and experience. Evolutionary understanding can help a little by showing why it's problematic, but it doesn't show any real quick solutions. Jerome Frank, I had the privilege of meeting in the 1970s. He'd written a book on persuasion and healing, showing that, hey, 200 therapies all work. How is it that all of them can work? And he said that they all have a few things in common: expectations of help, a relationship, and some theory and procedure that seems to make sense. And this is another meta-analysis of what actually makes differences in therapy outcomes. This is published in World Psychiatry a few years ago. And again, the overwhelming thing that makes a difference is the alliance, empathy, and the like, has effect sizes of 0.5, 0.6, pretty big for this kind of research. What method is not so important. Now, this leads to a problem because most people, when they're taught how to do psychotherapy, are taught how to do interpersonal therapy, or how to do cognitive behavioral therapy, or how to do psychoanalysis. And that's because you can't get tenure by talking about things in general, right? You've got to do things that are specific where you can gather data. But I think the reality that we can emphasize is that these relationship factors and trying to manage them and deal with them in a sensitive way with some evolutionary understanding are absolutely crucial. How do relationships help? People continue to argue about this because it's so hard to study. I think empathic understanding is intrinsically helpful. An alliance, helping to analyze and understand problems, encouragement to do hard things, whether it's to do your behavior therapy or to leave your abusive spouse, reframing events, insight, regression to the mean, unfortunately, is also an issue. If you get someone into your treatment room at the very worst time and you stick with them 3 months, 4 months, almost anything is going to look better because things will get better after a few months. And then finally, there's this wish to fulfill hopeful expectations. Cass Soper, I think, has emphasized this. He mentioned to it, but I haven't been able to find it in his book, and he might want to comment in a minute. I saw my dentist last week, and he did something that would help me with my tooth that's sensitive to cold. And I'm going to go back to him next week, and he's going to ask, is it better? And I'm pretty sure I'm going to say, yeah, I think it's better. And we'll see if that's an objective thing or not. And almost closing with Carl Rogers, he said, in my early years, I was asking the question, how can I treat or cure or change this person? Now I'd phrase the question in this way, how can I provide a relationship where this person may use for his own personal growth? I think that's actually too general. We do need specific modes of therapy, especially for specific problems, but nonetheless, it is a relationship that I think is so simple. There are risks to bringing an evolutionary view in. There's the risk of simplistic group selection thinking. There's the equal, and I think even more dire risk of simplistic selfish gene thinking. It's going to be very hard to embrace the rich complexity of evolutionary approaches to sociality and the diversity of relationships. But I think if we're going to succeed in making evolutionary theory useful for psychotherapy, we're going to need to try to do that. And then we need to be very aware that a simple objective analysis of what's being exchanged in a relationship often misses the whole point of a subjective, communal, and committed relationship. Nonetheless, we have huge opportunities here, I think, to bring in a basic science that's been missing from our work as psychotherapists and psychiatrists. It's available for us, and I think it can be as useful for psychiatry and psychotherapy as genetics is for medicine, which is to say, again, foundational, very useful, but in your everyday practice, not essential. Still useful. There's so much more to be done here. I look forward to hearing your comments and discussions. Thanks very much.
That was great, Randy. A really broad sweep of the literature, and I loved the art at the beginning of your talk. That was a really fascinating aspect. Now I can't see any hands, and I can't see anything in the chat. So while we're waiting, unless I've missed any, are there any hands?
See, Daniela has a hand up.
Okay. Unmute yourself, Daniela, and go ahead.
I just wondered what you thought about in terms of therapeutic relationships, in that if you look at a lot of human evolutionary history, the healers were part of the community. So they were people, I know where I work with the Totogue, the healer was down at the wells with everyone in the morning, also feeding his cattle and stuff. And so there were the healing came through relationships that were intrinsic and part of that community. And how different it is and how difficult it might be to be helping people with the therapists being separate, and whether maybe that's something because group therapy, maybe that can be more helpful because you're part of a group. But it just seems very so artificial. You don't often know anything about the therapist or the psychiatrist that you're seeing. They are this, whereas in our evolutionary history, you'd be mad to trust or with somebody that you didn't have that with.
And it's going further, Daniela, isn't it now, with insurance companies and others really pushing apps and bots to be our therapists. I mean, maybe a bot can just tell you to do your behavior therapy exercises and think positive and quit that negative thinking about yourself and the like. And again, these ideas spread very quickly because of the economic incentives for them. You can get rich making them, and you can not spend so much money as an insurance company promoting those kinds of things. But your point, I think, is very important. And it's awkward for us because, you know, if you're in a small town like Ann Arbor, where I was, you often see your patients in social settings. And in fact, you're kind of a part of the community, but you're not, because you want to maintain your social distance and have them not know too much about you in order to maintain the privacy, at least, that has been essential to psychoanalytic psychotherapy. But your point about the seer in the tribe, or the soothsayer or whatever, do you want to say anything more about that, Yellen? Because it's so crucial and different in these modern societies where we have anonymity.
Well, I mean, that figure that so much of healing happens in a relationship, and you know, so much. There was a talk at lunchtime today about how impoverished our relationships are in the modern world very often, and the sense that, you know, if healing is happening, you know, the relationship is much more important than the method. Is that telling us something about some of those models that might have to be dropped about traditional psychotherapy, about that distance, particularly the traditional, I think, psychoanalytic with the kind of blank slate therapist, but even more of that kind of, there's endless discussions on therapy groups about, you know, your client asks you this, would you tell them whether you have children or not? I mean, and it just seems that in a way, maybe the sort of anthropological and the evolutionary can help encourage people. Of course, there has to be protection because you're not part of a community and people are very damaged. But somehow, whether it might be a way of saying, look, this is such an unnatural relationship. How are you going to get any healing in it? And bringing in an ethos where there's more flexibility around those boundaries.
And then there are a lot of healing ceremonies in groups that are not just one great person doing it, but they're communal dancing. I mean, there's very profound stuff. Everybody's read Nesse, probably, Diary of a Hunter-Gatherer Woman. But if you read Return to Nesse, it's her attempt to go back to the group she was with to be healed for her breast cancer. And it's so moving and poignant and awful. But the ceremony she's looking for is one where there's not just one person sucking something out of you in a ceremony. It's a special healing communal dance. And I don't think we have much like that these days, but I don't go to raves, so maybe I'm missing something. So
I think it was Kent Bailey quite a few years ago who wrote about evolutionary approaches to psychotherapy and kind of introduced the concept of fictive kin, that the therapeutic relationship can simulate, because we are not adapted, or we haven't evolved to interact so intimately with a stranger in the way that psychotherapy, you know, operates in the modern world. That he suggested that that the concept of developing a kind of a fictive kinship would be. I mean, do you have any thoughts about that, Randy?
Only from doing psychotherapy, where transferences to parents become kind of the center of the therapy, where people start experiencing you as if you are a parent, usually a bad parent, or a limited parent, and hopefully understanding that experience and gradually it being transformed into something else. But even as I say these things, psychiatry has changed out from under us, right? I think a lot of these ideas seem very old-fashioned to people who are doing, quick cognitive behavioral therapy by the book, and the like. I think it remains the case that relationships are crucial to these quicker, more structured therapies. But I think it's hard for people to take in the possibility that things like you're talking about, Riyadh, like fictive kin and these kinds of transference relationships might be important.
I can't see any other hands up. But sorry.
Adam's
right. Yes, David. David Geeney. Do you want to unmute yourself, David, and Go ahead.
Yes, thank you. Thanks very much, Randy. It was a fascinating talk, and I suppose it occurred to me that to some extent you're covering the evolution of morality in trying to address the question of why this social behavior has developed at a cost to us, and I suppose that links for me a bit with why have we evolved to have a belief in a deity and
belief in
a god
and God, right.
a god, and I wondered what you thought of Dominic Johnson's idea that why we've evolved to have a belief in God to promote moral behavior is that when the groups that we lived in became larger, it was difficult for the community to directly sanction someone who offended against the group norms. And the belief in God meant that when the person was away from the large group, they still had this compulsion to behave in what we would consider now to be a moral way, because they felt that God was watching them. Hence the name of this book, God is Watching You.
And more than that, doing good in this life might be rewarded in an afterlife,
Yes.
which helps a lot with maintaining morals and the like. I'm so glad you brought this up, David. I'm not aware of Dominic's work on this, but there was a time in the early 80s when I thought I would spend my career writing about evolutionary understanding of capacities for religion, because it seems so pervasive and profoundly important in so many people's lives. I decided that it was too squishy a topic for me. And I started just to work on evolution medicine. And a lot of people have worked on this subsequently, very successfully, I think. But bringing it back to our topic today about evolution relationships, I had a whole other section of this talk that I dropped off, talking about people's relationships with a deity or a guru. And I think the most important relationship in many people's lives is a relationship with Jesus or some deity. And those kinds of relationships in many ways can be more secure than a relationship with any actual human. And something else I didn't say in the middle of my talk, which deserves further exploration, is that there was an article in the New York Times that got widely cited a few months ago about why your marriage will be disappointing. And it also reminds me of the tale of Genji, which is the story, one of the earliest novels, about a man trying to find the right good woman partner and going through a bunch of them and being disappointed, and finally choosing a girl and trying to raise her to be, every relationship, I think, is on some level disappointing, because no one can perfectly fulfill all of our fabulous expectations of them being perfectly generous and us not having to do too much. On the other hand, we have marvelous subjective capacities to overlook those things. And I think a lot of the function of repression, or at least one of the functions of repression and self-deception, is to preserve our relationships when our friends don't, in fact, live up to our often excessive expectations. And people who are a little too realistic in seeing everything exactly objectively, I think, get into trouble. Because they, every time a person does something for some other reason selfishly, they feel like they need to drop the relationship. And I think this is another danger of a crude evolutionary view, is that once you start seeing relationships in terms of exchanges and see others as not fulfilling perfect expectations, I think it can harm a person's ability to have relationships.
Paul, unmute yourself and go ahead.
Am I unmuted?
Yeah, we can hear you.
Lovely. Well, can I just thank Randy? That was a lovely talk, and perhaps sometimes I could scrounge your slides. I think they're some of the most useful I've seen for a long while. So thank you very much indeed for that. Very interesting. Just a personal reflection. I'm a biological psychiatrist, really, a psychopharmacologist, and I retired from practice, direct clinical practice, in 2015. Now, I think there's a lot of informal psychotherapy goes on with all the meds checks that I did. And I didn't underestimate that informal psychotherapy. And I think that's really important, even if you are a medical doctor rather than a psychotherapist. And this is borne out, I would say, that because of EPSIG, my email was made available to the wider public. And I still have a couple of dozen of patients who contact me on my emails, despite having retired 7 years ago. Yeah. And they're always very nice, and they're just keeping me up to date, telling me what they've been doing. And I send something back platitudinous and nice, and they still send me things.
They know you care about them, Paul.
Well, I sort of do, and I'm sort of heartbroken at having to retire because of, just because of age, and I've, done quite enough, and let's not go into all that. But it's showing you that the relationship was something they valued. I would hazard a guess.
Yes, indeed. And isn't it wonderful to have the privilege of having a longer term relationship with patients? One thing, I had another wonderful teacher who was an existential psychotherapist. And one of the things he taught me was how to deal with patients who kept wanting more and more and more and more. And the answer is not to tell them there are limits to what we can do and how close. In fact, the answer is to say, I want to meet you in 3 weeks. Can you make it? Instead of saying, I can't meet you next week. Instead, you take the initiative and make it very clear that you do care, you're going to be there, and you're not going to abandon anybody. It turns out but this is an example of the kind of clinical insight that doesn't come directly from evolutionary thinking, or maybe it does.
I think, Adam, you had a point, so unmute yourself and go ahead.
Yes, thanks, Riyad, and thanks, Randy, for a really interesting talk. I totally agree with you that social selection is this massively under-recognized. Yeah, we think so much about sexual selection, but I think the effect of our social relationships are probably so much more important for a lot of our emotions and our personality and our psychopathology. So yeah, it's really good to see you mention that. I found the slides when you were mentioning the various effects which might cause a particular disorder like kin selection and everything, and you run through all these evolutionary reasons, and then you put on the banner, which is I thought was very honest of you, of like, well, actually we don't need the evolutionary perspective to work out what's happening here. Your intuition will do it. I thought that was very honest of you, and interesting that you weren't claiming that evolutionary psychiatry can lend us this magic solution. I was wondering, I know you've written a bit about this. I was wondering how, even if, or whether, even if, the intuition of a good psychotherapist will be able to identify a person's problems and where in their life they have, they should be improving, or they could, the cause of their problems is coming. I was wondering if like an evolutionary approach might help them in some cases, kind of accept that and maybe take some advice for their life. So for instance, if you take a patient who's going through a really messy divorce, or is has, for whatever reason, or say someone who's been kind of taken away from their friend groups or something, and if you kind of gave an evolutionary explanation to them, saying, hey, you're a social animal, there's so much of your life that's meant to be social, and you're missing out on these very key relationships, and you've got this very strong pressure. If that can be therapeutic, is there something there that, even if the intuition of a psychotherapist might be important?
And that's a wonderful point, Adam. And even as I'm listening to everyone talk here, there is a lot to offer that an evolutionary perspective has. And sometimes it's essential to analyze what's going on in an evolutionary perspective. I recall one patient I saw who got a huge promotion at his high status job. We'll call him an accountant. But they moved him to an office where, instead of having 20 people working for him, it was him and a secretary. And he was making twice as much as he was before. He was a big cheese. He was hiring other people, but instead of having 20 people report, and I was able to talk to him about, gosh, you had relationships with these 20 underlings before who constantly made you feel like a big shot, and now they're gone and you feel like you're a depressed, worthless person, even though your objective status is much higher. This makes perfect sense in an evolutionary framework. And he essentially said, oh, that makes perfect sense. I think I'm just going to keep doing my work and keep hiring people in my office. However, this kind of insight doesn't help the kind of situation where somebody has actually lost their position, and they objectively have found themselves in a place where there are fewer people appreciating what they do. And this is what we all want in life, is people who appreciate us. And most of us, especially in our professions, find people really appreciating us. It's one of the very great satisfactions of being a psychiatrist or a psychotherapist. But a lot of people do not get that kind of satisfaction, and they're treated as if they're expendable members of a cog in a corporation. And often even in a marriage, they're treated as, either a meal ticket or a sexual object. And, I think Daniela was saying before about, the nature of relationships has changed, where, the kinds of long-term personal enmeshed and cultural relationships are not as common now as they were before. So this makes things rich and complex and difficult to manage.
Sorry, just to
go
follow
on,
up quickly.
go on, Adam.
I wonder if this, if on a kind of public health or on a public-wide perspective, this would kind of encourage people to be more socially supportive of each other in these situations. If everyone knew that, it's really important, then, you hear someone's lost their job and you visit them, you go and spend some time with them, which maybe we're not doing enough now.
Gosh, I think what's happening here in the States is a huge press to deal with a so-called epidemic of mental health emergencies, because people are lonely because of COVID. They're feeling, they've lost their jobs, and treating everything as if there's something wrong with the person who is feeling lonely, depressed, and anxious, and saying we need millions of more psychotherapists to help them. I'm not sure that's really a good idea in the long run.
Thank you.
I mean, there have been people. I mean, there some evolutionists like David Sloan Wilson, who's gone into the whole area of how evolution can provide insights into how organizations can work better, how offices can work better, how factories can work better, by recognizing that we are a species that develop bonded relationships, and we are not interchangeable and replaceable as some organizations seem to think, or at least behave in that way. Certainly our NHS in the UK seem to have developed this sort of managerialism where people are just replaceable. Any team can consist of any sort of X number of professions, regardless of who they are, and that's not how humans operate.
That's for sure. That's for sure, Riyadh. I mean, these are, gosh, this conversation is making me think that we really might be able to make progress by using an evolutionary perspective to talk about these very large-scale cultural changes in the nature of relationships. I remember being influenced a lot decades ago by a book on the culture of narcissism, claiming that whole society was becoming narcissistic. Which I think that's small potatoes compared to what we're dealing with now, with the kind of alienation and people in their phones instead of having real relationships and the like. This is all kind of distressing to talk about even.
Ooh, do you have something?
Paul, you have your hand up. Go ahead.
Yeah, I'd just like to agree with what you just said, Randy, and Riyadh, about, especially Riyadh's thing about the interchangeability of people in the NHS. The continuity is shot to pieces, and that's why I retired, put simply. However, putting it another way is, I think Randy knows a little bit about me being interested in the placebo and the evolution of placebo. The relationship is a large amount of what is the placebo effect, in my opinion. And of course, it's taken out of the equation in all the pharmacological and other therapy studies. And so it's the placebo is not just a way of having a controlled study, it's also a way of removing things like the relationship on the response of patients to medication. And the trouble is, it's also become derogatory. It's nothing more than placebo. So the relationship has become nothing more than the placebo response. Do you know what I mean? I'm probably expressing.
I do, and I see. I'm so glad to see you here, Cass. I'm hoping you'll want to make a comment on some of this. I think you have a lot to say about these things. You have to unmute yourself there.
Oh, well, yes. First, hello everybody, and thank you, Randy. What a really interesting talk. And yes, I should be stealing your slides too if I can get hold of them. And thank you for the to Riyadh and others for organising this talk. And I'm still. I was going to raise a question, but I'm still trying to frame it in my mind because there's so many questions that sprout out from all directions. And top of my mind, I've been working on this for some time and I don't have any answers, but I've been interested to know what you think, whether we are throwing baby out with the bathwater in the same way that placebo is often sort of excluded from analyses, even when placebo has some leveraging power, and what we may be throwing out with the bathwater here is, and I hate to use the word, but it arises in some of the literature, love. And I'm talking here about unconditional giving, the experience that a therapist, and not just a therapist, can give of being willing and able to devote themselves to somebody else's benefit for no gain at all. And there may be money changing hands, but that's by the by. But there's something of, and you mentioned it that at the end of the last of the slides, this extraordinary power of empathic understanding, which seems to me, apart from those 4 or 5 components of the relationship that you talked about earlier. I mean, it goes beyond kin selection and reciprocity. There's no mutualism involved. There's no back scratching, and there's not even. And I'm glad also you raised this business about partner choice and the peacock's tail. There's not even a sort of display involved. There is just a quiet, almost anonymous acceptance, respect, understanding. It is again. It's such a squidgy term. I hardly dare raise the word, but there's almost a spiritual connection of 2 fellow human beings on this journey together, and that connection of itself can be healing. What it is, we haven't. I don't even think we've begun to understand or look at where it comes from. But in any therapeutic relationship, there's a real sense that this exists, and I've yet to find in the mainstream literature a evolutionary explanation for this indescribable connection that seems to do much of the healing. Call it placebo, call it relationship, but it's there. Do you have a thought about this?
You know, the person I appreciate the most for his writings about this is Paul Gilbert. I'm sorry he's not here, but with his writings on compassion and its value both for the person who is experiencing it and for the person who's offering it. I mean, I think he's onto something very profound. Certainly many people in many religious traditions and other traditions have talked about the power of love, and it's on bumper stickers here in the States everywhere. It's, you know, the power of love is going to cure things, and it's so profound. But have we lost touch with? I mean, is that kind of embarrassing to talk about in proper psychiatry circles now? I think in general it is. You can't really do that. And why is that? We're coming back to these large cultural issues about how cultures and especially economic systems shape professions and approaches to these kinds of human problems. I think we want things that are objective and faster, better, cheaper. And that's understandable, right? If you're running the NHS, you want, something that's efficient to help more people more cheaply and improve the health of the populace, which seems to be a long ways from the intensely personal, hard to describe connection that is so often very helpful for individuals. These are profound issues, Cass. I look forward to talking with you in Lisbon.
We have Brenda, who's got her hand up. So unmute yourself and go ahead, Brenda.
Hello. So, Kaz, what you were just talking about there, and I think a lot of what we've been talking about, I think of in terms of that yearning for connection. And in evolutionary terms, I wonder where that comes from. But my question is about if anybody has any comments about trade-offs when it comes to relationships, when it comes to the behavioural traits that we demonstrate. The yearning to connect needs to be balanced with the need to protect, in domestic violence. So what can trade-offs tell us in this space in psychiatry?
So I'm trying to grasp that question, Brenda. So you're asking about how we can manage the proper distance in a way that maintains closeness without compromising our privacy and the like? Say more, if you could.
I'm thinking of an example of foraging, when a bird will be driven to eat, but will also have to look to the sky to make sure there are no eagles. And so the trade-off between how to find the right balance, still stay alive, get enough food, but also don't be in too much danger. With relationships, it's much harder to find the balance. I just think trade-offs, might be a way of looking at things.
So bringing in trade-offs is a very nice way of looking at this. And I haven't actually tried to suss out exactly what are the trade-offs with the increased closeness versus decreased closeness in different kinds of relationships, not just in therapy, but with relationships in general. And who are you going to tell your secrets to? Sometimes you really want to share them with somebody, but they might put it on Twitter tomorrow. And so you really have to be increasingly careful about those things. I think your comments and those of a few other people make me want to back off of my excess, possibly concern about crude applications of evolution to these kinds of things, and instead mention that it's not as if every therapist has perfect empathy and creates relationships at the right distance that are proper healing relationships. A lot of them miss the point, and also therapy is a moral enterprise, and because it is, this often results in therapists having moral expectations for their patients, which sometimes are at odds with what that person is actually doing or needs to do and the like, and setting very high standards, which a lot of people can't actually live up to. And it might well be that, a slightly more hard-nosed view of how relationships actually work and how these things work might help some therapists to be more realistic in ways that can actually help their patients more than their just intuitive views. So sometimes those therapeutic intuitions are just wishes for what marriages should be like and what mother and child relationship should be like. And I'm thinking of Daniela's work now as well about the deaf mother, and in particular, the fact that, we have this image of what we want mothers to be like, and we do therapy with mothers, essentially saying, you really should be this kind of a mother. And it's not always true. It's not always possible. And I think an evolutionary view of the sort that she has suggested we consider can be very therapeutic.
I mean, one of my thoughts, Randy, is that evolutionists may not need to reinvent the wheel. There is a lot of wisdom already there in the field of psychotherapy and so forth, and there are concepts such as the therapeutic alliance and the therapeutic relationship and so forth, but we may well have a very, very important role as evolutionists to actually explore what are the evolutionary roots of these very important concepts that others have intuitively introduced, and they are important, but I think if we can provide a if we can reframe them into an evolutionary explore their evolutionary roots and their evolutionary origins, we may have an important role here in making these into more grounded concepts that may be more kind of productive than just simply the terminology that exists in psychotherapy today.
I love that idea, Riyadh. So instead of creating some new kind of evolutionary psychotherapy or something, we recognize that the wisdom and skills that have gradually developed as the whole idea of psychotherapy has developed. And we try to show how some of those fit very nicely in an evolutionary framework for how relationships work and how people change and how people can use these evolutionary ideas. I like that very much, Riyadh.
I've just had a thought about the psychotherapy relationship itself, but how weird it is, picking up on what Cass said, with kind of, you know, love and that unconditional desire to support somebody you don't know and aren't related to, which would, you know, in traditional societies probably come through kin selection, and at the same time for it actually to be so transactional, because money is nearly always explicitly handed over, and kind of what a weird human juxtaposition that is in terms of relationships, and whether that might at some level, I've got no idea how one might explore it, but if one's really looking at what's effective in healing, because I think that's often with clients a big issue, isn't it, is do you really care about me? You're getting paid, right? So, and actually that's
so you've just spurred an idea, Daniela, because, you know, I always thought it was essential to deal with the issue of money in a way that was sensitive and difficult and adjust and address the patient's suspicion that because money was being paid, it wasn't a genuine caring relationship. But I wonder if the very fact that you can experience a caring relationship that does involve the transaction of money couldn't actually expand that individual's view to the possibility that other relationships that involve transactions could also be genuinely caring as a model. You spur very interesting ideas, Daniela.
And also something about the reciprocity, you know, if you think about hunter-gatherers or something, you know, people genuinely care about each other, but there is an exchange of meat going on or an exchange of gathered berries, right? That is, most relationships within most communities are both caring, you know, within functioning, emotionally functioning, warm communities are both caring and transactional, not as a kind of as explicit as handing over money, but whether there might, I don't know, I'm just sort of playing with whether there might be something that we could do, maybe even as a group, but evolutionarily, and try and tease something apart that might bring some clarity to that. Or
and this whole idea that there are different kinds of relationships, you know, some of that are transactional and based on exchanges explicitly, and some that are based on caring emotions and commitment, and almost all relationships that have aspects of both. I mean, I think that might be possible to address in therapy. So that people can not feel like this relationship actually has to be based just on caring and commitment, with ignoring all the transactions, or just transactional without, you know, paying attention to commitment, because all relationships are actually both. And maybe this is an avenue where we could offer a sophisticated and sensitive approach to the reality of relationships that people could appreciate.
So, unless, I mean, if there's anyone who wishes to,
sorry,
Brenda has had her hand up before she. So, is this a new hand up, or
it's a new hand?
Yes. Okay. Great. Go ahead, Brenda.
Actually, it's just to play devil's advocate and to speak to the other side of the the positive side of the transactional relationship in psychotherapy, because I think there are individuals who really appreciate that they can come to a place which is not run by the rules of social complexity that they're having trouble with, and they're allowed to come into a place, and the rules are that you have to talk about them and not yourself. and I think they find that quite valuable, and I think in some ways the paying of the money is almost a recognition, is we're not doing this exactly like it's done out there, we're doing it in a version which allows rehabilitation. So it's like learning to walk after you've broken your leg. It's in a modified version until you find your strength. And I think that that transactional quality kind of makes it a little bit more explicit that it's different from the norm. They don't have to worry about everything.
I mean, the fact of the money changing hands justifies it being a one-sided thing where one person listens and the other talks. Yes, very, very good point, Brendan.
If there is any last words that anyone wishes to contribute, I can't see any hands, but please unmute yourself and put forward a brief contribution if there is anyone. If not,
Club EvMed is ongoing right now, so we should get ourselves over there. Anybody who's interested.
Right. Okay. Well, I would like to thank Randy for a great talk and a great discussion, really thought-provoking session. And the good news is that all of this is going to be posted on YouTube for anyone who wishes to recommend it and distribute it or whatever to other interested colleagues, students, researchers, and others. So thanks again, Randy.
Thanks so much for organizing, Riyadh. Good to see you all.
Thank you. Thank you.
Thanks,
all
everyone.
the best.